Assalamu alaikum and welcome. My name is Selma Ishag and I'm representing Alkayria81 charity organization. I'm representing Alkayria81 charity organization, and I would like to talk to you about a project that has been a source of happiness and hope for me. And I hope that by the end of this talk, I'm successful in having you share the same optimism that I have. Before we try to take a peek into the future, let's look at the state of healthcare in Sudan today. This is okay. Sorry, to start over. Is that better? Before we try to take a peek into the future, let's look at the state of healthcare in Sudan today. According to the WHO, the mortality rate in Sudan is twice, maybe even 3 times that in the developed world. Our maternal mortality rate and infant mortality rate is even more dismal. A person from Sudan hopes to enjoy 50 to 59 years of healthy life compared to 70 or 79 years of healthy life in the developed world. And you can imagine the implications of that for the individual and for the economy of the country as a whole. So what is getting done about it? Nothing. In fact, the public spending on healthcare as a percentage of GDP is actually going down over the years. And just to clarify, it may look like it's what we spend is consistent with what Egypt spends on healthcare, but we have to remember that 2% of GDP in Egypt equals $5 billion, more than $5 billion. For us, it's 1.5% is about $1 billion. If we consider that Egypt has doubled the population of Sudan, that means that Egypt spends 2.5 times as much per person for healthcare than we do. This is the number of physicians per 1,000 population. We have 0.3 physicians for every 1,000 people in Sudan. And this metric is important because it is used by ranking agencies to rank healthcare in different countries. And based on this and other parameters, I am sure, Sudan has been ranked at the bottom of the world. We have the worst healthcare system in the world. Number of nurses and midwives per 1,000 population, we have 0.5 nurses for every 1,000 people. And I'm just comparing to Switzerland. Switzerland has 17. And I think, we all know that correlation does not equal causation, but maybe this people in Switzerland are onto something when they focus on nurses and they focus on midwives for delivery of healthcare. So, like Shami said, a group of physicians physicians, dentists, and pharmacists who entered a medical school at or around 1981 founded a non-profit, non-political organization called Alkayria81 organization. And together, we believe that with our collective effort, our collective determination, and our collective resources, we can have an impact on healthcare in Sudan. And our vision, what we see is that we see our efforts impacting the future of healthcare in Sudan to provide care that is up to date, that is accessible, that is acceptable, that is dignified, and that is without discrimination. When we started, we were involved in a few projects. I'm going to go over some of them briefly. This is supplies to Sinja Hospital, and it still amazes me when I realized that that was the first time that Sinja Hospital in 2013, that was their first introduction to pulse oximetry. We did support Sobo Hospital on many initiatives, including but not limited to This is a vascular ultrasound for their high dependency unit, some pulse oximeters, some peak flow meters. This is for a SHAB teaching hospital. We supplied monitors for their ICU. And we also sponsored a breast cancer mission last year, which included patient care procedures, mainly sentinel lymph node biopsy, and a very strong didactic program that was really very well received. But I'm here to talk to you today about our hospitals project, مشروع مستشفياتنا. This is by far the most ambitious project that Alkayria81 is undertaking. And in this project, our focus is to partner with a rural hospital in Sudan for 3 years and help and support and guide that hospital to become a model institution. And we do that by two things. Number one, we partner. We do a lot of work to partner with people in the community as well as the hospital, and working with the community to encourage and support them to create a local hospital friends organization to support the hospital services and to engage the local community to become active participants in their own healthcare. We collaborate with the hospital to form voluntary professional committees, example, critical care, emergency room, operating room committees, infrastructure, infection control, environment and sanitation committees. We help them in the creation of a continuing medical and nursing education division, in the implementation of an up-to-date medical records department with trained staff using standardized policies and procedures, with the application of international treatment protocols, checklists, and patient flowcharts, in reviewing their performance metrics and the evaluation of the emergency and operating rooms, in having regular meetings with all department heads, assessing their needs, and encouraging consistent reporting to the hospital administration of needs, as well as long and short-term planning and goals. And in setting up referral clinics and collaborations with visiting physicians, example, a metabolic clinic, an asthma clinic, and a pain clinic. So about a year ago, we signed a memorandum of understanding with Kosti Teaching Hospital, and everyone went to work. The hospital now has a critical care emergency room operating room committee, a continuing education committee, a medical supplies and pharmaceuticals committee, maintenance and infrastructure committee. And I would like to add here that this is the first time in my life I have seen a hospital administration in Sudan having a committee where there are people from the representatives from the highest level of the administration, and at the same time there are members from the maintenance and housekeeping crew. And I think this is good for everyone. People in the community of Kosti have gone to work as well, and right away they were able to register their organization, and they came up with a fundraising procedure. They have a very streamlined process, and this process focuses on two things: on accountability and on transparency. Anyone who donates to this program gets an email confirmation of receipt of their donation, and at the same time they are invited to an online group where they can see that their donation is acknowledged and they see where their funds are being used. And these are the members of this organization going around in the markets everywhere to raise funds. I think this is not just an opportunity to raise funds, but to even bond with the community. And speaking of bonding, I really want to say that this group is so hardworking, so professional, so dedicated and motivated that I also feel I have bonded with them. And I truly am privileged and honored to be working with them. Why are they collecting money? One of the goals is that listening to the community, to hospital staff, and of reviewing some of the statistics, we realized the need for an intensive care unit in Kosti Teaching Hospital. This is a hospital that serves more than 500,000 people, and that there is not one single high-level care bed in it. So one of our goals now is to establish an intensive care unit over there. And what we have done, we have sent 7 physicians to the fundamentals of critical care support courses, the courses that Selma took to Sudan. We have also sponsored a 5-day event in Kosti Teaching Hospital where 44 physicians and nurses were trained in basic life support, and of those, 36 were trained in advanced life support. More importantly, 8 of those people were chosen as future trainees. And this is consistent with one of our goals. We would like to see Kosti Teaching Hospital becoming an educational hub in the area. And we would like to have the life support courses being trained by personnel from that hospital. Thank you. I really want to comment on this picture at the bottom here, where our young colleagues are so eager and hungry for knowledge. I admit this picture actually inspires me, and it keeps me going when I get a little bit discouraged. And I want to say that when we sponsored only 36 people for this project, for this course, the first day 44 people showed up because they want to learn, they want to advance, and they want to serve. And I think it is our responsibility to help them in what they're trying to do. We also sponsored 4 sisters to go to Ashab Teaching Hospital, where they spent 4 months undergoing an intensive hands-on training in the intensive care unit there, as well as 5 in Ahmed Qasim Hospital. So this is a crew of 9 sisters and technicians who will be the future nursing leaders of the intensive care unit. And not only did they have a hands-on training, they also had lectures, courses in ventilator management, in oxygen therapy, and this is my favorite, in the art of patient care in the intensive care unit, as well as basic and advanced life support courses. We also sent 2 engineers to the Heart Institute to be trained there for 1 month. And the process of renovating and expanding the ICU is almost finished, as you can see. We now have a medical director for the ICU. It's an open concept ICU. Anyone can admit patients and take care of them there, but we have a medical director. We also have a nursing director. We have a social worker. We have an agreement with the hospital now to have a social worker, which is somewhat of a new concept, but this social worker will be our link between the hospital and the Friends organization to help patients in need. We also have a dietitian, which is again a relatively new concept. And in the future, we're looking at involving the dietitian in our health education programs within the city itself. We are now in discussion with the hospital to have our dedicated housekeeping and patient care tech teams for the ICU. We are also writing forms for not just for the ICU, but for the whole hospital, and actually for all of the White Nile province. And this is a form, a nursing form, nursing admission form. And again, I believe this is something new. In our ICU, our nurses will admit patients and write an H&P on them. They are going to write at the bottom there, they're going to write their nursing plan of care. And when we were discussing with them what they want to use for documentation, English or Arabic, they chose English. And I understand that this may be a little bit difficult just because of the educational background, but I really admire the fact that they look at themselves as leaders who are setting a standard for themselves and for those who follow after them. If you look on this slanted paper at the bottom, there are 3 lines for patient representative. All patients admitted to our ICU will have dedicated representatives for communication. And this is education for everyone, for medical care personnel and for families, for individuals. Patients have rights to make decisions patients have rights for their privacy. We want to introduce this higher standard in our hospitals. So there's a lot of work to be done. But if I have managed to get you excited about this project, please help us and donate for the Friends of Kosti Hospital organization, because I think together we will be able to one day see that healthcare is truly a human right in Sudan. And finally, I would like to leave you with the words: of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Thank you. Thank you.